the situation is dire. As you all know, more than 1 million people have been displaced in Cabo Delgado because of the conflict. And in addition to that, more than 150 people have been affected because of the cyclone Freddy, which made a landfall on 24th of February. As we speak now, more than 136 schools have been destroyed, partially destroyed, and more than 45,000 children are not going to school. So the situation is dire. Children are not going to school. More than 15,000 people are in a resettlement camps. They don't have homes. Their homes have been affected by the rains and the floods. Most of the people, they need urgent support, urgent needs for them to continue to survive.
Mr. Magashi, just talk to us about the latest situation. As we mentioned, that it has exacerbated those already in the eye of the storm, literally. And I'm particularly wondering about the rural areas, those in those conflict-ridden areas. How are they surviving? Many of them already live way below the poverty line in structures that cannot even be called decent housing. They are constantly without food, not only because of insecurity, but because of the major poverty.
Yeah, you're right, and this is a very serious situation we are at the moment, whereby most of the children, the young women, and particularly girls, that are suffering at the moment because of inadequate water supply. And when I'm talking about water, I'm talking about potable water. There's also a disease, the cholera is also, is an outbreak here in Mozambique. There's also some affection of cholera. The food aspect is also an important issue where most of the displaced people are having problem of food. But we are glad that the government has given us access to be able to reach the displaced people, and also World Food Program is trying their best to try to supply food, but the needs are not met. The needs are high. There's an urgent need of humanitarian access, support, and also we are calling for the donor all over the world to support, this dire situation that we are having currently now in Mozambique.
What numbers are we looking at? I believe last year Cyclone Gombe alone affected, I think, about close to 1 million people. And there was also Cyclone Anna last year. So we're talking about Cyclone Freddy this year. Just how many people are facing food insecurity and displacement? And how much of them are actually...
I'll talk about it.
Okay, you can go ahead.
The displacement of the Freddy now is closer to 150 for now. The ones that have been affected. And the report that we are getting from OCHA, it demonstrates that around 15,000 people are now in the resettlement camps where they need support. They don't have homes. Their home has been actually affected by the floods and the water in their house. Some of them, they have been partially destroyed by the rains. So more than 15,000 are in resettlement camps that they need the basic needs, the basic support. So that's the situation that we have at the moment. And this is including all the people that are in Maputo and the area of, Nyambani and Gaza. That's where the problem is happening at the moment. So there's a dire, and as I said, the water problem is also continuing, and the outbreak of cholera is also threatening, the lives of the children, young women, and the girls that are suffering at the moment.
One of the Burundian refugees there saying that the roof collapsed on her house. She said it was just a matter of minutes before they had no home. She just evacuated her 7 children outside. And she described it as just like escaping a conflict. So I'm just wondering the mental health of some of these victims, and how do they feel? Because some of them are in remote places. And what I was trying to ask you is about how easy it is for some of them to even access assistance.
The assistance, as I said, is a bit tough for the time being, and the people that have been happening, that they're getting this problem, they're going through a bit of a trauma. So psychosocial support is also quite important to have. There's a humanitarian people, humanitarian agencies that are getting the access. They provide that the psychosocial support. But at the moment, we are looking for a life-saving intervention in terms of the food, in terms of the medicine, in terms of the shelter, in terms of the dignity kits that they can keep surviving the team, they keep surviving the people that have been affected. That's the priority for now. The life-saving is a priority for now. Then, of course, then will come up some other intervention like a psychosocial support to ensure the people who have been affected, they are getting the necessary support, to recover from the trauma that they have gotten from the effect of the cyclone Freddy.